our special guest, John Hallick, who is the co-founder of the MET Crusaders group. John, welcome. Thank you so much for joining us.
Good to be here. Thank you.
Absolutely, yeah. And then we also have Kristen Johnston, who's the Chief Nursing Officer of Massive Bio on the line as well. So what we want to do today is just, talk a bit with John, understand the experience that he's had and kind of what brought about MET Crusaders. So John, let's just go ahead and get started.
Sure. Yeah. So I was let me start back a little earlier. So I was actually cross-training in December 2017, January of 2018, rolling the big tires and the ropes and everything, and got what I thought was a cold. And so I went to the local clinic, and they thought that I had the flu. And so they gave me some antibiotic and said, if you're not better in 10 days, come back and see us. Try something new. 10 days went by and I wasn't any gooder. I was worse. So I went back in, and so this time I had, you have bronchitis. They gave me prednisone. And so I went on that for another 10 days or so. Didn't get any better. And so I went back in, and they finally did a chest x-ray and decided that I had a mass in my right lung. And so they suggested I immediately get a CT scan. What I find was also interesting is 9 months before this x-ray, I had another x-ray, and it was clear. So, the 9-month period. So I called my doctor and told them what was going on, and they scheduled a battery of tests for me in a day or two. All the normal things, PET scans, the bone scans, the scan scans. I think I had all of it. And it didn't really, they did a biomarker testing and a biopsy, but the biomarker test didn't come back for a couple of weeks. No diagnosis without the biomarker. Was stage 4 metastatic cancer of the bronchus and lungs.
Okay.
The 1st of February of 2018.
Now, did you request the genetic testing, or was that something that was immediately done, or what? Were you familiar with that?
Yeah, I was not familiar with it. I wouldn't have known to ask for it.
Okay.
Luckily, I had the right doctors, and they did the biomarker testing. It turned out I had MET14 skipping. I found that out about 2 or 3 weeks later.
Okay.
And at the time, the doctor said, well, we really don't know much about it. And so they just treated me with chemotherapy and checkpoint inhibitors. I had carboplatin, Alimta, and pembrolizumab, Keytruda. So I went on that regime. They basically threw everything they had at me. I lost 65 pounds.
Wow.
Have my hearing, which didn't come back. Within on the bottom of my feet. I've had red blood cells a couple of times because they got killed. So it was no fun. I looked pretty emaciated at the time. After about 4 or 5 sessions, we took off the carboplatin because it was just too harsh. It's like a sledgehammer. And we continued on with the Alimta and the Keytruda with kind of a minimal response. There was a mixed response. And so they kept trying. And at the end of 5 months, they said, well, we really need to find something. And at the time, an opening for capmatinib, which is now Prabecta, and they had 5 seats, and I was number 2.
Okay. Trial.
For part of the first 200, countrywide. But each of the hospitals only have so many seats.
Yeah. So that was part of the clinical trial.
Yes, it was.
Okay.
The interesting part was between the time I signed up for the clinical trial or applied, and after my last chemo, all of my tumor shrank about a third.
Wow.
So now it's like, do you go into the clinical trial or do you stay the course? So the way they explained it to me was that the tumor that appeared to be expanding were actually absorbing the Keytruda and made them get larger. And when I hit the threshold value, everything just shrunk.
Right. Exactly. Exactly.
When I call like the rebound effect or whatever.
Right.
So I decided, I can always go back to Lipton Keytruda, right? But I can't go on with the trial because it's one of those you're either in it or not in it.
Now or never, right?
No, never. So I decided I would go on with the trial. The drug was amazing. The drug's amazing. I had originally I had cancer in my pelvis, my abdomen, my lungs, none of my brain. But everything started shrinking, and not massively. I mean, I have people at MET Crusaders that I have one woman that had brain cancer, lung, and bones, and in 6 weeks they can't find it. It's not evident. But we've had some cases where it's amazing. Mine was really more slower than that, but I have no evidence of disease in my pelvis, my abdomen, my brain, and I have a little bit in my right lung. So
is this what made you create the group MET Crusaders and start that up?
Yeah, it was
about that.
Yeah, not kind of no. At the time, I barely knew what a biomarker was. Right, I was trying to figure out how to stay alive. My background is primarily in entrepreneurship and building businesses. Right, so they said, "Well, why don't you start a biomarker group?" Okay, well, I figured out what it is. So I took up the challenge and kind of learned as I went along. I found another individual that had a Facebook group. And so I kind of used that as a platform. And I had a lot of people kind of push me through it. And so it's evolved from the end of April, a year plus ago, to where it is today. And so made a lot of progress. We publish newsletters. We have webinars. I have a webinar coming up on Friday. I spoke recently for the FDA. We have people from all over the world talk to us about, their needs. We're kind of advocate navigators. So, we're trying to help people. Yes.
Is the group specifically for patients with MET amplifications or alterations, mutations and such, or can anybody with lung cancer join?
So no, it's not. It's specifically MET specific, MET 14. We mostly MET 14. Obviously, that's the statistics. MET amplifications, confusion. They may have a secondary driving mutation.
Mm-hmm.
We really focus on MET and MET research and MET doctors. Is a handful. We recently formed a thing called the Biomarker Collaborative. There's like 10 groups like this. And then we work together on larger initiatives, but also I don't have to worry about learning everything about ALK. So we can all specialize, but we can all work together for the benefit of the patient.
Absolutely. Absolutely. That's the thing. Well, great. So you talked a little bit about, your experience with clinical trials, it sounded like it was, successful. How many trials have you participated in? Just that one?
I've only participated in one clinical trial.
No.
However, as the head of MET Crusaders, I taught a lot of patients and a lot of trials and know how difficult trials are. We publish a list of clinical trials because, as you know, it's hard to find the right trial. And just last week spoke for the FDA on the decentralization of clinical trials so that we could bring more people into clinical trials. And there are a lot of people being excluded because they don't have geographic access.
Right.
And that's a problem, it's a big problem.
Definitely. Yeah, I know, and we are definitely aware of that. And especially here at Massive Bio, we recognize that, a lot of patients and really the education too behind the clinical trials and the treatment options that are out there. And just being able to help the patients find that right trial and even in their geographic regions, with what we're able to do with the matching, which you're familiar with, we're able to, search trials within a 50 to 100-mile radius, or we can even expand to a 500-mile radius if the patient's willing to travel. But really just finding that right treatment for the patient and in that clinical trial is very important. And still, advocating and assisting those patients in finding the right trial, getting enrolled, and making sure they understand what they're getting enrolled into.
And I think that's something that we have in common, John, Massive Bio and MET Crusaders, is encouraging patients to learn more and step outside of their comfort zone and really get all of the information that is needed for clinical trials, for NGS testing, just so that they know all of their options and they know the exact mutations they have as well.
Yeah, the clinical trial, the thing that I've kind of learned is the clinical trial is actually for many of us the preferred treatment plan. And it may be even better than the approved treatment plan. I mean, let's face it, at the approved treatment work, we would need clinical trials, right?
Right.
And it's a complex problem.
For those patients, maybe who are being diagnosed, maybe what's some advice for the next generation sequencing testing, the NGS testing that we're talking about, for that, the genetic testing to identify that MET mutation. Do you have any suggestions for those patients that maybe their physician hasn't recommended it yet, or just maybe giving them some education on the importance of that?
Well, every lung cancer patient and every cancer patient, we deal with more than just lung. I mean, I have people with MET that have bile ducts, all kinds of places. So this is more than just lung cancer. But everybody with cancer should be tested. There's so many treatments out there, and you can't match the treatment to the person without being biomarker tested.
And that,
and so we want everybody tested, and every time you have progression, you should be tested, because the mutation that causes progression might be different than the original driver mutation. So testing is really, really important.
absolutely.
So can you share, I think, what are your goals for MET Crusaders and moving forward? What are you hoping to accomplish?
Sure. Well, I'll give it to you in no specific order, because it's hard to say what's first and what's second. So the first thing that I'd like to do is try to engage with every patient that has a MET mutation, because MET Crusaders is of no value unless you know about us and you're engaged with us. So unless we're engaged with you, we can't help you. So that's my number one goal, and it's very difficult. to do, but we're working on some strategies. Once we're engaged with people, we want to try to make sure they're being diagnosed properly, they're being properly educated, they know how to be their own best advocate, what we can do for them, and make sure that their cancer journey is the best possible scenario. It's the best path available at that specific time. Obviously, it changes over time. So we want to help them with that path, and that includes, like I said, helping them find second opinions, educating them about drugs. We're not doctors. We don't tell people what drug they should or they shouldn't be on, but we can share with them experiences. We have a MET Crusaders Facebook group where patients can talk to patients and have a sense of community. That they're not the only one that has this, and they ask questions of each other all the time. I spend more and more of my time with research projects. We have a cell line project that we're working on. We're helping sponsor a couple of new drugs. We deal with pharmas all the time. I talk to them probably every at least once a month. I'll talk to the pharmas, make sure that our needs are first and foremost, so that they know we need drugs and what kind of drugs we need. Many times I will speak to their employees to let them know put a face on the work that they're doing. We want to help on that journey, ensure it's the absolute right path for that person.
Absolutely.
Yeah. Absolutely. Yeah. Thanks, Tom.
Those are good goals, and patients, every patient deserves that kind of support and the advocacy and really just the support from you, but also from all of the other members and anybody that they can rely on and ask questions to. So I think that is fantastic, and what you're doing and your goals are phenomenal.
Yeah. Yeah. And Massive Bio is definitely happy to collaborate with MET Crusaders. I mean, we're very excited to be helping in any way that we can with the members of the MET Crusaders group, and helping you all find the trials and do the pre-screening, like you mentioned, to get the process started with what we're able to assist with collaborating with you. We start with the pre-screening, and then even go all the way through helping the patients get enrolled to the trial. So however we can assist with the members of the MET Crusader group, we're absolutely here as well.
Yeah, I mean, we will work with patients with compassionate use. Sometimes they can't even get into a trial, and they need a drug, and so we work with the pharmas for compassionate use. Sometimes they can't afford the cost of comprehensive biomarker testing, and so we'll work with the groups to try to get those tests for them. So there's this beyond the trial. I mean, there's all this financial support system that you have to try to get so these tools are available, because even though they may be available, they may not be able to afford it. And the thing with clinical trials, I've seen this a couple of times. Sometimes a patient will just say, "I give up," because they worry about the financial ruin of their family. That just devastate. It's horrible. It's just horrible.
Mm-hmm. Yeah. Yeah. And that's I think we all here recognize, the importance of advocating for that patient. I mean, end to end, I know that's part of where your passion comes from, where the Massive Bio passion comes from, in trying to help these patients end to end, get pre-screened, but also get enrolled. But what does the enrollment consist of, and what questions do they have? Like you said, financial support. So I think we're all on the same page there as far as recognizing the importance and trying to assist these patients however we can. Yeah. All right, John. Well, this was really great. We loved hearing more of your story. Thank you for sharing that with us. I think that's great for other patients out there. and talking about your experience in clinical trials. I think that's very helpful for patients who have questions, and then also just bringing more attention to MET Crusaders in general. We definitely want to be able to help all those patients and get in touch with you and utilize your services. So, as we wrap up, do you have any suggestions for patients out there, and these kind of next steps, or just advice that you can give them?
Well, I would say the number one thing I would tell people is, and I know that this is difficult. I mean, people are thrown into a situation they've never been in before. It's a life and death situation. It doesn't compute. They just go in a kind of shock. But somehow you have to transcend that and learn to be your own best advocate. You have to ask questions. You have to be a partner with the doctor. You can't just say yes to everything. Ask lots of questions. If you feel uncomfortable about anything, get a second opinion. And if you're worried about the doctor's getting this feeling hurt or her feelings hurt, you got the wrong doctor. Because it's all about you, not about them.
Absolutely. I love that. Thank you so much, John.
My pleasure.
That's great advice.
Awesome. Well, great. Well, thank you so much, John, again, for taking the time and being here with us today.